Hi all, I'm Dr. Liam, osteopath here at Melbourne Headache Solutions. Today we're going to have a chat about different sleep disorders and their relationship with headache. So if you suffer from a sleep disorder, or you or your partner are avid snorers and suffer from headaches, then this video might just be the one that helps you. Now, we've all snored at once in our lives, but if you're a regular snorer, it could be a sign that you have a sleeping disorder known as sleep apnea. So sleep apnea is an obstructive disease that is caused by blockages in the nasal passage or the throat, and is characterized by pauses in our breathing or shallow pauses in our breathing that would occur for longer than what would be considered normal. These pauses usually last from a few seconds and can even last a few minutes. As a result of this, patients often have a decrease in the oxygen in their blood upon wakening, which then can lead to headache. A very recent study last year showed that among patients who are diagnosed with sleep apnea, 30% of those patients suffer from headache or migraine. So those patients will not have a normal sleep routine, and they will not feel rested, or after a night's sleep feel pretty tired, and 1/3 of those patients end up getting headaches. So what does that mean for you? Well, if you're a snorer and you get headaches or migraine, it might be wise to go and get checked at your local GP and explain to them what's going on, because there could be a link between your headaches and your snoring. In a lot of cases, sleep apnea is, when effectively treated, the headaches improve or they stop altogether. So that would be great. It'd be a great help for you. Another type of headache that can be related to our sleep in the absence of sleep apnea is a wake-up headache. People are at risk of getting headaches during the morning, and this is because headaches are most active in the early hours of the morning. Another reason is that patients that are using over-the-counter medication, most often those medications only last 4 to 8 hours. So therefore, they've worn off by the time that we wake up or early in the morning. So it's important that if you're suffering from medication withdrawal headaches, that you speak to your GP about different ways you can wean off the medication, because our body can become used to it and reliant on it. And then we start to get further issues like rebound headache, which are really nasty. There's also a link between our sleep, headache, and our mood due to some chemicals, namely serotonin and melatonin, which affect these things. It's been shown that poor sleep can lead to chemical imbalances in the brain, which then cause mood changes, which then can lead to depression and anxiety, and then also causes headaches, which just stresses to me the importance of sleep, a good sleep, which would be 7 to 8 hours a night. So I guess things that you could do to help yourself: no screens before bed for the hour before bed, going to bed and waking up at the same time each night, trying to avoid nicotine, alcohol, tea and coffee before bed, and also practicing some things like meditation or mindfulness as well. If that doesn't help, you could also try and supplement with some melatonin, but make sure you don't use it for too long, because your body can get used to that, and then that your body adapts to it, and then it makes it harder to sleep again. So you want to just take it for a little bit just to get you into a good cycle. I hope this helps, and if you have any worries that you may have a sleep disorder that's affecting your headaches, then I suggest booking an appointment with your GP and having a review, because you can get some clarity, do some tests and stuff like that, because it can be quite dangerous. Also, if you have any comments, let us know and how to help people get to sleep. Thanks. Bye.